So I have been wondering or been thinking about how I could help the community since now the actual insurance of the United States has changed now that the Medicaid expansion has been taken out from certain states, limited funding for medical services through insurance. My expertise is in Medicare and Medicaid. I also know how to bill commercial insurances as well as TRICARE, veteran benefits. So I think for my first video, I should talk about the difference between Medicare and Medicaid. Medicare is national insurance. You get it if you're disabled for 2 years and you have a work history more than 10 years and you actually had worked within the last 5 years. You could get Medicare also if you are over 65 through your work benefits. Again, if you have 10 years, it could be on and off, like a roofer. It could be 6 months on, 6 months off, 20 years of doing that. That equals your 10 years credit. Also, if your spouse has got the 10 years work credit, you've been married more than 10 years, and you get it at 65. Then there's the HMO product of the actual Medicare. So HMO is when I say, hey, I have Medicare, but I want to go Aetna Medicare, Anthem Medicare. They're to act like Medicare, they're to cover like Medicare, and if they do not cover like Medicare, you're able to complain and call 1-800-MEDICARE. Then there is the Medicaid aspect. That is through the states. That is for those that are low income. Maybe you're born with a disability. Maybe you're born with cerebral palsy, so they have early intervention for those young kiddos. And then as they get older, they also have the developmental disabilities waiver. They have long-term care through Medicaid. If you think about grandma, or even, again, that cerebral palsy child that eventually turns 18, 21, then they're able to get the coverage through state, because even if you build your commercial insurance for incontinence supplies for your cerebral palsy child that is very involved, it'll tell you bill Medicaid. It actually has that code built in there. That's part of the reason why the Affordable Care Act said you will cover pre-existing conditions, but that could be discussed further on in other ones. And just like Medicaid to Medicare, they have the MCO versus HMO, managed care options, again, like Aetna, Anthem, United Healthcare. So again, those MCOs are to pay like Medicaid. Also, if you happen to have Medicare and Medicaid, you're to never go to collections. If you have Medicaid, you shouldn't go to collections. Sometimes you have that $100 copay, but that, again, will be discussed in further videos. So message me if you have questions.